prepared a brief presentation of what is the situation in Finland at the moment. So are you able to see my screen? Is it visible? Yeah. So our application launched about a month ago. So we have been, of course, collecting lots of experience right at the moment. The application name we are using is called Koronavilkku, which is Finnish, and it means Corona Blinker in English. Little bit special name, but I guess everyone has received it rather well. So this is the official application for Finland, and it's implemented for the Finnish Institute for Health and Welfare by the company I'm working in, Solida. Our first goal when we were developing the app was what we were saying out loud was that we would be very happy if our application would have 1 million downloads during the first month, but we were thinking that that might be too unrealistic. So what happened was that we were able to have 1 million downloads during the first 24 hours, and of course that took our quite much as a surprise. At the moment, there are over 2 million downloads of the application, which means that about the 40% of the Finnish population have downloaded the application. And according to the statistics of the phone sellers and such, this means that over half of Finnish smartphones have currently Koronavilkku installed, which is, of course, we are very, very proud of this achievement and very happy with it too. Some little information we have been able to collect from the application. Actually, it is very much the same as the Swiss application, and it was very interesting to see how the numbers compare. And for example, this is the number of the PIN codes, the COVID codes that other countries are using that are generated for the Finnish users. This is the daily number of the codes generated, and the black line represents a moving average for the 7 days. So as you can see, after the launching, the number of generated codes has been increasing, of course, quite fast, but at the same time, also the number of infections themselves in Finland has also unfortunately been increasing. So we have very increasing trend in here, of course, visible. Usually the people in Finland receive the PIN code as a text message to their phone. So this is like an option that is first offered to everyone, but there is of course a small number of people who are receiving the code on the other methods. For example, they are able to receive it on paper or spoken via phone, and of course if they might be even meeting the doctor, they are able to get the code as face-to-face. But as you can see here, almost 100% of the codes we are using, they are sent as a text message. We have implemented the active link inside the text message so that people can easily use this as to activate their code sharing functionality. The number we have been receiving from our analytics is that when we have been comparing the generated codes to those codes that have been actually used, we see that almost 80% of the people who have received the code are actually using it. This happens even when there are quite strict rules for using the code. The PIN code we are generating is single use only, and we have set it to expire in 4 hours to prevent misuse. We were a little bit worried about maybe that if is the 4 hours maybe too short a time, but seems that it isn't. People are able to successfully report their infections, and most are also doing that. When comparing to the number of infections, we see that almost 1,000 people have received the code for infection reporting during the September, the first month we have been active. And when comparing this to the total number of infections in Finland, it means that nearly 30% of all registered infections in Finland are reported to the coronavirus application at the moment. So I believe this is rather good figure, and we are of course also proud of this, and we are expecting this to have an actual impact for the sharing of the disease in Finland. There is this dotted line in here. This means that there are delays of registration delays for the actual number of infections in Finland, and that's why it is showing a little bit higher numbers for the latest days, but the actual number is somewhere around 40%. Well, as you all know, and what was said before, we are not able to tell the number of warnings we are generating because that is happening inside the phones. But we do know that because our application offers a link to the symptom checker service for all the people who have received the warning, we know that 1,500 people have chosen to use the symptom checker. The link we are offering them is a special link that is not available to other users. It means that we are able to calculate the people who have been receiving the warning and acting upon it. And currently, the numbers show that each infection report produces about 2.1 symptoms checks. So it looks like the people are, of course, using the information they are receiving, also receiving the warnings, which makes us, of course, very happy, so that we know that our application is functioning properly. But this has been a very brief report in Finland. To summarize, we are very, very proud of it and very, very happy about the current situation in here. And of course, we are looking forward to numbers growing all the time.
Thank you so much, Sami. That was really great. Maybe just to start, what are some of the things you did to get 2 million downloads in a week? 40% of your population, that's tremendous. So
yeah, it might, of course, there are many reasons. One of the reasons is that Finland as a country is very forward-looking, and people are very eager to take digital services and start using them. So it's like common for all people. Also, Finns tend to trust the government quite a lot, so there hasn't been that many people who are like wondering if they have been like there's some kind of government surveillance or something going on. But one of the reasons has also been that we have been very open with our development. So we have been actively giving out information about what's happening in the development process, and the press and media has been following us very closely. And we have been, of course, been happy to talk with everyone who has something to ask, and been very active in social media and in other medias too. And all the different parties have been very, very happy to talk with us, and we have also been very successful of convincing people to about that we are making quality product that is protecting their privacy. There has been a couple of examples. For example, a local group of white hat hackers was invited to take part of taking a look at the software and giving their opinion. And they were giving a quite good praise for that one, as was the local security companies and things like that. And because we were audited by the local security official, that was made also public, that we got good marks about it. So all in all, the population in Finland is very receiving, and we got good reputation, and the media handled us very, very nicely. So it was like the perfect storm of many positive signals.
May we all be that lucky. And so one of the things you mentioned was the high number of codes that got entered into the app. One thing that other teams have been seeing, and I know Switzerland mentioned this in their presentation, is that they have the same system to generate the test codes as to generate real codes. And that's one of the things that makes it a little harder to know how many codes are actually getting entered. Did you create a separate test system, or are you not having that problem?
Well, we do have separate development system, but we have also been generating test codes within here. But then again, I don't see that as a problem because the number of test codes generated is rather small share of the actual codes that have been generated. Of course, we are aware of that one, and we have taken this into account in the statistics as much as possible. But I don't think it has very big effect on numbers in here.
Yeah, and then Ron asked if is your app integrated into your manual contact tracing systems in any way, or is it completely separate?
Well, what our application does is it's providing the contact information for healthcare, and then it's providing the link to the system, which is providing the symptoms checker. And within that, that is when the people go to the hands of the general manual tracing people. But as you may already, other countries may all have seen that manual tracers and infection doctors have been somewhat unhappy that they don't receive much information from our application. But then again, when we said that this is very important because of the privacy, so we are taking the high road of having full privacy. They generally have understood what's the situation here. They all are seeing this as an additional tool to help the manual tracing, but of course it is not replacing it.
Yeah, absolutely. I think getting that message across that this is a supplement to manual tracing, that it's not a replacement, is absolutely important. And maybe a couple of questions around the verification codes, because you have a lot of information on those. So one is, why did you create the 4-hour limit on the codes? What were you trying to balance there?
Well, when we were having the audition of the security people, of course, one of the threats that came into mind that we were quite aware of was that there is a possibility to use the PIN codes wrongly. For example, if they are like the hostile parties who would get their hands on the codes, they would be able to generate false alerts. And therefore, we decided to create, of course, the time limit for the code. And because we are using only the numbers in the code, so it's a PIN code, it's only numbers and it's 12 digits, we calculated that to provide enough entropy for this 4 hours would be the proper time limit for the code. Of course, there was lots of discussions. People were somewhat worried that is it too short? Should it be longer? But seems that it has been quite good. And of course, there is always possibility to generate other code for people who are, for example, missing this. But generally, we are not using that possibility. So we are discouraging to generating the additional codes.
Great. And then also, we got another question. That when you're sending the code via SMS, are you doing anything to verify that you're sending the code to the same person who tested positive?
Yeah, the code generation interface is used by the healthcare official who is reporting the positive test result for the person, and it is usually the same person who is also sending the SMS key. Another possibility is that it is a tracer who is contacting the person and at the same time also sending out the SMS for the person. So usually I think, of course, there is a possibility that the code could go to the wrong address, but I believe the people sending out the codes are careful enough.
Absolutely. Okay. Very helpful. And then, so you said that you know how a report can lead, when somebody gets an infection report, that it can lead to symptom checking. How do you have that link? How are you tracking that?
Yeah, it's actually a web link. The symptom checker service has been around already for half a year, and so we were providing the link to that service. It is almost the same link that the general public is able to use, but we are adding one parameter to it to recognize the people who are coming from our service. Of course, it doesn't give out any personal information, but that way we are able to calculate people coming around. It's not a secret parameter, so there's always a possibility that somebody is finding out the parameter and using that, but I think that's quite remote possibility. So if somebody starts to use this for the wrong purposes or anything, then we see what happens, but we have been happy about this very simple solution.
That's great. That is really wonderful. And I think with that, so we are out of time. Thank you so much for sharing this information, Sami. Congratulations on getting on such fantastic adoption. It's really thrilling to hear that.